So lastly, I will be explaining our second diagnosis for our nursing plan of care. For the second diagnosis, we stated that the patient may have ineffective breathing patterns during inspiration or expiration that does not provide adequate ventilation for the patient. The first short-term goal for this diagnosis is that the client experiences effective breathing at a normal rate and depth and also has no appearance of dyspnea, and this can be depicted by 8 to 24 breaths per minute. Some nursing interventions for this would be to assess the patient's respiratory rate, rhythm, and depth to see if it is normal. Next would be to assess for any increase in breathing. This can be noted through shortness of breath and through the use of accessory muscles. Lastly would be to monitor oxygen saturation, as it should be at least 95%. The next short-term goal is that the patient is able to express relief or improvement in dyspnea and can also verbally express causative effects. The first nursing intervention would be to provide information on cause and risk factors for prevention so that the patient is knowledgeable. The next intervention would be to encourage the patient to try and take in deep breathing exercises to allow maximum oxygen to get to the lungs, and this should also help reduce anxiety.